Hey everyone, welcome to today's video. We're going to be talking about a specific condition of the hip called a cam lesion. Before we get started, my name is Joe Rendina, founder of Iron Health here, and I'm here with Maria.
Hello, how is everyone?
So we're going to be getting into the specifics of anatomy, assessment, and then you could check on some exercises as well. We just want to educate you guys, and if you like this video, just give us a like, thumbs up. Maria is going to take us away with some anatomy.
So when we talk about a cam lesion, we're talking about the hip area. That's the body part that's affected here. And so basically the hip is a ball and socket joint. So this is the socket if I use my hand here, and then the other hand is the ball. And so the femoral head and the acetabulum connect together to create the hip joint. So a cam lesion basically just means that on the neck of the femoral head, there is a bony overgrowth. And when you have a bony overgrowth on that specific part of the hip, it can actually limit the function of the hip. So the hip has many different motions that it goes into. Primarily, we use more in the sagittal plane front, so it's hip flexion and extension. But when we talk about a cam lesion, mostly we'll see a limitation in hip flexion. With rotation, we can go in and we can go out. And so with this lesion, we also have a limitation of how far we can go in. So when we have these limitations, of course, that's going to affect our overall function, and we can have some pain with this. So going up and down stairs can be painful, sitting for a long period of time, squatting down to grab something, all those things can be a limiting factor with this type of condition.
Well said. So we're going to go into some specific assessments of the cam lesion. Now, when you have general hip pain, this might be one thing that is there. It is not the thing. Just remember that. Just don't go around saying I have a cam lesion. We're just showing you a specific condition. So we're going to use Maria here as a model. The first thing I like to take a look at is their general rotation. So can you turn and face the back wall?
Sure.
Feet together. So the reason I always have feet together on assessment is really just to make it standard. Arms at your side, and now rotate to your left as far as you can go. So gross or multi-segmental rotation really shows a lot. Can you keep going? Mm-hmm. Good. So we're looking at the spine and the hips as well. Good. Can you go the other way? Mm-hmm. Good. And I would say she's more restricted going to the right. It's just a nice little assessment. Do you feel that? Mm-hmm. Yeah. So this is a quick way to see what is their movement like. Doesn't necessarily mean it's coming from the hip, but just giving you a sense of, hey, if I'm restricted one way because of that bony overgrowth, might be hitting the pelvis, is not allowing you to move. So usually from there, I'll break it down even more, but today I'm gonna just show you on her back and then on her stomach some ways I see if it's a cam. So go ahead and lay on your back for me. How are your hips? Mm-hmm. Good? Mm-hmm. Okay, so one thing I like to see if it's a cam lesion, we'll go into full flexion. So the key with flexion is really see where the knee goes and if there is resistance. So with Maria, I actually get some resistance here, and I'm pushing from the heel because I want to see what her body does to it. So let's see. I'm going to keep pushing from the heel, and you can see, if you can keep your eyes on that, she naturally wants to go more out, which is very common for females anyways, but it's something to address and keep an eye on. So if I come in, what does that feel like to you?
Tight.
Just tight, but this is a general, hey, how is your hip socket moving? This can actually be a good test too for a squat, which we can get into later. From here, I look at rotation in a 90-degree angle, IR external, internal, and then really to see if there's an impingement or if the camera is restricted is to compare side by side and to see if there's a pinch. So one test I do is I'll bring her into flexion and then IR. Does that bother you?
A little pinchy.
Yeah. So naturally her body doesn't want her to get in that position, but this is a provocative maneuver for the hip. And if something pinches, something may be going on in there. Then we have external as well. Okay, another one we like to use as well is a scour. We come up into this position, kind of grind the hip itself across the body. That bothers you?
Not too much,
Not
just
too
pinchy.
Much. But sometimes if you have a cam lesion or something else in the hip, it may really light you up. Just flip to your stomach. So those are two I like to look at in supine. In prone, so on her stomach, I just like to see what the hip looks like side to side. So on your back versus your stomach, the hip is in a different position It's either being flexed when you're on your back, now it's an extension. So if the restrictions are different, usually that means it's tissue oriented. If they're the same, then there might be a joint, which may lead you down the route of a cam type lesion. So these are a couple little tests we look at. And here, our motion is very similar, prone to supine. So those are basic tests. Now usually you want to make sure you look at both side to side to really get an assessment. But try those out, let us know what you think.
So we're now going to move into the treatment section. So what we're going to focus on in this clip is going over a mobility exercise. So mobility is really important as well as strength, but mobility is going to get more range of motion that your body then can control in the new range that we create. So Joe talked about assessing rotation in our assessment. So to basically treat what we see, we're going to do an exercise called the open book. So I have Joe here on the table lying on his side. So one leg on the bottom is going to be completely straight, and then the top one is going to be essentially kind of like folded over the bottom one. The purpose is to kind of lock out the back more into like rotation when he opens, as he'll demonstrate soon. And you can kind of get a really good stretch of the hip on the side here. So he's going to open up his arm. As you see, he's rotating open. He's actually getting a really great pec stretch, so in the chest area, and he's rotating his entire spine. So it's a really great way to get motion of the entire body, hip and back. So then he's going to come to a close. So he's closing the book. He's going back into the starting position. You can even see when he closes, his knee is closer down to the table. And then when he opens, this is actually how you can see he has some restriction. It comes up off the table. So the more that we practice, the more range that we're going to get, and the more that we can move in a new range. So let's come back to a close, and you'll just repeat that. Let's say for 10 repetitions, maybe 20 repetitions, you could break it up. The more mobility you do in a day, the better off that your body will feel long term.
All right, so our next exercise is going to be another one of them under the mobility category for a cam lesion. Maria's already sitting in this position. It's called a 90-90 drill. So the reason it's called 90-90 is because you're making 90-degree angles with both legs. From here, the first step is, can you get into this position comfortably? Can you sit here? That's what I like to see. The second thing I would like to do or add is twisting. So what we're going to have Maria do is turn her shoulders to the right. Good, keeping her chest up. And then come back to the left. Turn. Good. And you can hold it in each position, which is really nice. She's a good example of this because she has pretty good mobility. Not everyone's going to look like this. If I did it on myself, I do not look like this. So what we can do for an addition to make it a little more comfortable is to actually elevate your backside so your hips can have more range of motion. So she'll actually sit on that, on the leg that is externally rotated. And then from this position, it's going to be a little more comfortable. The goal is going to be trying to get that right leg down to the mat and at the same time keeping the left down. Honestly, it might be just a good drill to start getting into this position before you even add the twisting. It's hard enough to do that. So try it out. All right, our next exercise is going to be for strengthening the hips. Again, cam lesion. There might not be things you can do, honestly, that are going to totally affect the joint. Once that bony overgrowth starts to come, it's not going to subside. So the key is to maintain as much mobility as you can and then gain as much strength. So what I like to do, it's very basic. You could do this at the kitchen counter. You could do this in the bathroom when you're brushing your teeth. We have a band here on Maria's feet. She's going to stand on her left leg. So just in that premise, your hips have to stabilize. She's giving a little input to that left foot. Now we're adding hip abduction, 45-degree angle to the right leg. Tap and then back. So there's a lot of stuff happening under the surface here. You have to keep stable subconsciously. You're working the right hip and you're also working the left hip. But it's important to do both sides here. So this is a small little exercise that will start to get the hip muscles firing. Now, the reason small exercises work as well is you're building strength, but there's stabilization that has to happen to create kind of the rotator cuff of the hip to fire, which is very important to make sure that you could take that onto functional activity.
Okay, so we're going into another strength exercise. So even though this next movement is going to be more so for the core, working your core for stability of the entire body, including your hips, is very important. Your core is literally part of your pelvis, and your pelvis is part of the hips. So we're going to really get the center strong, so everything coming out of the center has stability. So we're going to go into an exercise called the pail-off press. So Joe is going to be my patient here, and he's going to hold the handle here from the cable column. And so he is stepped away from the cable column purposely because he's going to have some tension in the column. And so then he's going to straighten out his arms in front of him. And while you do that, with this weight attached over here, is going to challenge your core. So you can either take further steps away if you need to have more tension in the column, or you can extend and then come back, extend and come back. And the whole time your body needs to create stability to keep your arms straight out in front of you while this weight wants to pull you back here. And so it's going to recruit all the muscles for stability purposes and get your body more stable and strong.
All right, everyone, if you liked that video, please give us a thumbs up and subscribe. We're trying to build this channel, and comment too, because we're going to keep developing videos that are crafted for you. So the more you comment, the more information you give us, the better videos we can create. So we are the Powered by Iron Health channel. Check us out. Thank you.